everybody. Thank you for joining us down here. I am going to shorten my comments a little bit because I learned in our last sessions that really we want to be hearing from our panelists who have just been incredible examples of community researcher practice over the 3 long, difficult years that we just experienced. So we know that policymaking during the pandemic was uniquely challenging. It had to happen rapidly, it was very stressful, and there was often limited information. And the role of science and scientists was undermined just when it had its greatest importance. In the context of school, the debates also became inappropriately framed as a battle between the public health and the economic needs of our communities. And in the midst of all of these challenges, a number of critical issues often went unnoticed: equity, the social, emotional, and learning needs of children, and the voices of parents. And so today we're going to do a little bit of a what did we learn for the next time, by talking about how these issues were navigated in the Bay Area in the context of school reopening policies, and what we learned through that experience about collaboration between physicians and scientists and other sectors that were deeply engaged in this work in schools. So this was a superb example of policymaking being informed by evidence even while that evidence was still building. So this was when decision-making was exceptionally difficult. And I think this is the stuff we need to understand in order to be better scientists in an era of misinformation and distrust in particular. So we have 4 really privileged panelists, all engaged in their own way in supporting decision-making around school COVID policies in the Bay Area. We were fortunate to convene these same panelists in the midst of the pandemic to talk about their ongoing work. And if you check out the Impact website, you can see some phenomenal highlights from that conversation. And now we're taking the opportunity to look back on what we've learned for the future. So, here on my closest to me here, we have Yvette Edwards, who is co-founder and board member of San Francisco Parent Coalition, a collective formed during summer of 2020 in response to the pandemic in order to ensure that education leaders in San Francisco center the needs of children and youth in San Francisco public schools. She holds a law degree from Syracuse University College of Law and is the parent of a 4th and 6th grader. We then have Jenny Lamb, who is past president of the San Francisco Board of Education and has been a member of that board since 2019. She's also the director of policy and strategic partnerships in the Department of Early Childhood and previously served as education advisor to Mayor London Breed. Thank you for being here. We next have Sailaja Suresh, who's the Executive Director of Systems and Services for Oakland Unified School District. She managed central services to school sites and the district's COVID response during the pandemic. She previously worked as a founding teacher and then a principal at Oakland International High School, serving recently arrived immigrant and refugee students. She has a master's in education from the Harvard Graduate School of Education. So 3 different sectors working collaboratively on the implementation of policies. And then we have Naomi Bardach, who's a professor of pediatrics and policy here at UCSF. From December 2020 to September 2021, she served as California's Health and Human Service Agency state lead for the multi-agency Safe Schools for All team. So thank you to all of you for being here to talk about how you were able to work together. I'm going to ask a number of questions of our panelists first, and then I'll open it up for questions from you guys. And I'm going to start with Commissioner Lamb. So you were the commissioner of the San Francisco Board of Education, and education advisor to the mayor of San Francisco during the pandemic. What do you know now that wish you had known during the pandemic as far as school reopening goes? And can you put that also in the context of how science and evidence played a role?
Good afternoon, everyone. It's really wonderful to be here in person. And that is a really big question. And us panelists are just reflecting back around what a journey experience trauma it has been. I'll just open up with, I was in the room when San Francisco Unified made the decision to close schools. I was with the superintendent, the cabinet, and I knew as soon as we were debriefing, getting briefed by our public health officials, that when we made the decision, our lives were going to be changed forever. And I wanted to open up with this because the intensity and the responsibility that each one of us as leaders, not only in that room, but soon, once that decision was made, we knew what was at stake. And the stake was children's lives, our educators and our staff and their lives, and would be forever changed in their learning. In San Francisco, we have one of the largest learning, equity, achievement gaps of any district in the state of California. And that is why I cried the day that we announced that we were going to close our schools, not because the district was going to do everything humanly possible to keep our students and our staff safe, but knowing what the experience of our families and what was ahead around their learning was uncharted, right? It was nothing any of us have learned before. So I just want to say a little context there. And Hilary, remind me around your question again, because I want to be able to start.
What do you know now that you wish you had known during the pandemic as far as school reopening goes? And what role did science play in that?
Well, science absolutely was at the heart of it, at the center of it. That was why it was so imperative that in San Francisco, right, we have our amazing partners here at UCSF. We have our public health officials. We have our mayor, Mayor Breed, who made the tough decisions that she needed to make for the betterment of our city. There's so much learning. I feel like I could write a book about it. I won't take up too much time, but a couple key things is around, first and foremost, around policy making. The Board of Education with our superintendent needed to create greater space around community engagement and dialogue outside of a forum that is not school board meetings. School board meetings are not engagement, nor are they dialogue, because we are inhibited by law, the state of California, that public comment is not engagement. So what I would have, looking back now, is leading with that effort, grounded also in sharing the latest research, the latest data, but also hearing where our families, our students, and our staff were at. We really did not create that space, and that is why I'm so grateful to leaders, parent leaders like Yvette, and thousands more, that we needed to create those spaces early on. Another learning is around the connection between roles and responsibility, between policymakers like Board of Educations and superintendents and executive teams. I think that was very confusing to people around understanding what those roles were. Now, I'm going to take some liberty to dive into what I saw as learnings for SFUSD. I think one of the challenges was to be able to create a very designated and key, kind of similar to, I think school districts for decades now have been asked to fill in for the gaps of communities, meaning that, like, we have wellness centers, right? We have a wellness center in every high school. We have been a national model for 20 years now. We have, provided food and nutrition for all of our families, no matter what your background is. So we immediately knew we were gonna have to stand that up quickly. And looking back, one of the greatest learnings is I think we would have even further benefited standing up a COVID command center, either with injunction right there with the city and county of San Francisco, or standing that up in SFUSD, because we did not have enough people, resources, expertise to do that on our own. And now, as just finished 10 months of serving as board president, also seeing how critical consensus building is with colleagues at the board level and working with our chief executive officer, our superintendent. And that is the learnings that through my time as board president was so key to rebuilding that trust, leading with policy, leading with outcomes, and how are we going to measure ourselves towards that progress? And that could be really gleaned to that approach for our COVID and our response.
Thank you. So Commissioner Lamb brought up the challenges in talking with parents at the meetings. Can you talk a little bit about how you as a parent were accessing information and how also you were able to give information about your own expertise to the school board and even to researchers who were engaged in the process like Naomi Bardach?
Yeah, sure. I mean, there's so many common themes between what Jenny just said, what I heard upstairs in the session right before this related to community, communication, trust building. And for me, what really needed to be happening that wasn't happening broadly enough was getting that information out. So when Lisa mentioned implementation, it did not appear that that information was getting out. Now, it was changing rapidly, totally got that as a parent, but it wasn't being spread very well. So for me in particular, I've told this story, I was very sick in March 2020, right at the lockdown, at the time where they were telling you not to come in unless you were experiencing breathing trouble. But it put me on a very, as you can imagine, anxious path. And I was terrified. And at that time was like, well, that's it, kids, it's a wrap. You're not going back to school pretty much ever. Like, I think you'll see college, maybe. And, but that was sort of the level of anxiety that I think everyone was feeling because everything was so new. And I kept my house in that sort of state and realized that I was putting that anxiety onto my children, who were already struggling with so many different things, distance learning, we're all sitting at this kitchen table, and it had to stop, but I wasn't sure how it was gonna stop, so I happened to join a Facebook group of parents and just kind of talking about things at that time, not even really focused on reopening, but hearing from other places throughout this country that hadn't closed down, that were slowly having summer sessions. In fact, our city during the summer of 2020 was holding community hubs in small cohorts where people were able to send their children. And it seemed to a lot of us like, this is interesting. There seems like there's some sort of way for kids to be in a room. I randomly found a UCSF rounds, I think they were called at the time. Scrolling in the middle of the night, just anxious again. And it was Dr. Bardach's. And the conversation she was holding, and I believe it was a conversation, I don't even think it had really gotten out. I think it was just amongst colleagues. But when I listened and I heard, I thought to myself, wait a minute, this is possible? Why don't we know this? Why has this not been put out into the community? Why is UCSF not sharing this with everyone? Like, this is something that I think would have changed the entire course of the conversation before schools were even considering to open in August 2020. So, as this group continued to form, I thought to myself, legal research and writing is my background, a little bit of a Nancy Drew, and I said, people need to be able to make informed decisions for themselves. We can't keep having these conversations. We can't keep hiding these conversations. We reached out to the Board of Ed, just a group of parents, which I want to make clear, were parents throughout this city in all different levels, right? We had people who had gone back to work in grocery stores. We had doctors from UCSF who were parents with their kids in public schools. We had people like me. We had educators who were ready to go back. So at that time, it just seemed like, okay, let's have a conversation. Let's make sure that people get this information. We reached out to the Board of Ed. They weren't really holding any town halls. UCSF wasn't really able to do it. So one of the very first things we did with one of my colleagues that I met from San Francisco Parent Coalition, who worked here, Dr. Vanessa Thompson, I told her what I had seen. I said, this would be amazing. And we said, let's throw a webinar. No idea how to do it. Let's throw a webinar. Let's get this out there. Let's invite the Board of Ed. Let's invite UESF. Let's invite everyone and see if maybe, just maybe, we can start a conversation. Because nationally, the conversation was chaotic. And frankly, here in the city, and I want to bring it back to trust, amongst you guys, it was a little bit chaotic for a lot of families too. So social media was how I got my information. Webinar, so again, pushing out that information was how we got it to the broader community. 500 people attended that webinar with Dr. Bardach and Dr. Raul Gutierrez from Zuckerberg. Vanessa was able somehow to get UCSF to sponsor it, so we had no idea how to throw on a webinar. We found 2 volunteer translators in our community. Everything was still grassroots, and that really shifted, I think, a lot of people's minds, but it also reminded people that it should not be a well-kept secret, that you have to be able to access the information to a layperson in a way that they can accept it. So I think that that was, for me, the main thing. And I will say, you know, because it went on for months, where, you know, doctors are having this conversation, we don't agree with that, we don't agree with that. And at the end of the day, it became sort of a battle of Mortal Kombat in this city on a lot of different levels, because people were going to listen to the doctors that they believed, because that's what they wanted to believe, right? So just being able to have professional conversations and putting the information out in a professional way would really go a long way in the way that we communicate to others, especially when science is changing so quickly. But I do think that the most important driver is just making sure that it's not a well-kept secret, whatever it is, good or bad, because I think everyone was afraid to say something and then be attacked later on Twitter if it changed 2 weeks later. So, yes.
Such good messages for us. Okay, Ms. Suresh, you were involved very deeply in the implementation of the policies that were being created at the district level and at the school level, and with the input of parents. Can you talk about what you needed from the health community early in the pandemic to do your job? And looking back, what do you wish you had from us that you didn't have?
Yeah, thank you for the question. Yeah, I think probably 2 things that we were really looking for from the health community. I think first was education, right, of just what is going on, what is this, how does it spread, how does it not spread, how do we keep ourselves safe? And I think in Oakland, quite early, I think it was maybe May or June of 2020, sometime that summer, we did have a team of physicians who stepped up from UCSF and said, hey, how can we help? And some of them were parents in Oakland. All of them were interested in just making sure that they were translating the science for parents, for educators, for families, to just understand what COVID was and how we could safely have students and teachers in schools. So that was incredibly critical. But I think the second piece was also just looking for some empathy and acknowledgement of the unique situation that schools were in. And what I mean by that is, you know, there were a lot of recommendations that came out at various points during the pandemic and the reopening around things like social distancing, things like cohorting students, things like in relationship to cohorting students, when new students could be brought into the class or taken out of the class. That logistically, if you're an administrator or if you're a teacher, don't work very easily in the school context. And so some ability to partner in how do we create recommendations that are realistic for the school context. Knowing that there's such a huge barrier just with people's feelings in coming back to school, where every time we held community engagements in different parts of the city, in different languages, we would hear very firmly on both sides of the spectrum, why haven't you opened schools yet? Or please don't open schools ever again, right? Like people were feeling very strong in their standpoints. And we knew that, and we trusted in the science, and we said, we're just going to present you with the best information available. We're going to do our best to reopen safely, and how can we do that in a way that is logistically feasible, knowing that as a principal coming in with staff, I'm going to also have staff on all sides of that spectrum as well.
So Dr. Bardach, you very quickly became a little bit of the person known to be able to build some of these bridges between research and different sectors and stakeholders. How did you become involved in doing it, and how did you do it so well so that you were able to become a trusted resource to people in all of these different camps?
The first way that I became involved actually is I was March 2020, things shut down. I'm a pediatrician at Zuckerberg San Francisco General Hospital. Many of my patients were therefore going to be disproportionately affected, and their education disproportionately affected, and their future lifetime health disproportionately affected by the shutdown. So I felt very strongly that we needed to figure out how to get reopened. My son also had a lot of mental health issues in response to the shutdown. So I had two very major compelling reasons for trying to get things reopened. And I'm a researcher, and so in healthcare delivery mostly. But I sort of said, okay, research skills can be translated into these school questions, and how are we going to use research in order to get the schools reopened? But I also knew that I couldn't do it just by myself. You can't do that in a vacuum. So I partnered with public health. I reached out to Tomas Aragon, who I think might be here. He was upstairs. Hey, Tomas. Thank you so much for it's an amazing partnership to sort of be like, what do you guys think? What can we do? How can we get the schools reopened in a way that feels safe from a public health perspective, but also then partnering with teachers and with parents to say, how will you feel safe going back? So all of the research, I was doing research design. I was trying to figure out, how can we do a study that will actually answer this question of how to get back to school safely? This was like April of 2020, when I actually had a theory that maybe a ton of people had already had COVID and we just hadn't detected it. So I was going to go into hubs and try and do serum testing for antibodies. That was my original discussion with George Rutherford and also Tomas. We ended up finding out that that actually probably wasn't true, so we didn't pursue that. But then we tried to figure out, how can we design a study where we actually begin to roll out school reopening with different mitigation strategies. So much of this came from this idea of like, how can we reassure people using science, but also partnering with everybody who's on the ground to inform that science in order to actually create something very actionable? So that was sort of the general way that I got involved. As I began to learn more and more about school reopening, I did grand rounds for Dr. Wachter, who's the Department of Medicine. He asked me, I told him I needed to do grand rounds. And although it's public, it was actually publicly accessible, right? Like, which is how you found it. But I think the fact that we needed a messenger, it couldn't just be that it was something that people would find. I think the idea that you guys led with, let's engage the community and bring people to hear that message, I think was actually really important, an important piece of it. So I think that's probably a decent summary, but many other lessons learned.
So I want to just open it up to the full panel to reflect a minute on uncertainty and how you make policy decisions and decisions on behalf of community organizations in the face of scientific uncertainty, and how that could have been made easier for you.
I was going to answering that question, also your question before, which is how did I do something about communicating? And I did realize early on when I was giving talks after that initial grand rounds, a lot of what I did at the beginning of every talk was to say, what I say to you today might change tomorrow because we know things are changing rapidly, but this is the best evidence we have right now, and that informs our decisions. And I make a commitment to you that I will continue to look at the evidence, and that we might need to change it in the future. So I think being very clear about that, I think, is really helpful. It doesn't always help because people feel uncomfortable with the fact that things change so much. But at least being transparent and saying I'm committed to following the evidence and being flexible in the face of new information, I think was actually at least helpful for me and seemed to resonate with people.
I really want to have real talk because it was so difficult to be able to navigate the ever-changing day-to-day. And I think looking back, while it is it isn't natural of my human essence around partnerships and trust building, that was not the case, and it isn't the case when it comes to complex public systems, particularly public education systems. And I think it was just like the perfect storm, so to speak, of complex systems of public health and complex systems of public education, and especially particularly for a large urban district, that it's like moving an enormous vessel. And so that in itself does not fit well, to think that you can adapt an enormous vessel to daily changing of a pandemic and our research and learning. And so with that, I think in reflection is greater engagement between Board of Educations. And again, I absolutely value local autonomy in decision making. That's how we arrive at, in the state of California, of how public education systems operate. At the same time, when you do that, you have over 1,000 school districts in the state of California. So you basically have 1,000 ways that things can go. Now, we tried to go in coalition. You know, SFUSD is one of the 8th largest school districts in the state of California, along with our colleagues, Oakland Unified. And in reflection now, what we ended up doing in working with Dr. Pan, and what we did as board as a regional approach. We regionally said, all right, we've been in this pandemic now for a year. We have to approach our work differently at the policy level. And so we, the Bay Area region, school board members came together and started to put together a strategy around the testing approach, and also highlighting to Dr. Pan, our state legislators, our policymakers around, this is what's happening on the ground. This is what's happening on the ground a year later. While we appreciate the work that's happening with our colleagues in our state agencies, but this is what we're seeing, and this is what we need. This is what help we need. And I think looking back now, if we would have gotten together earlier as a region, along with our superintendents, like our superintendents, I'm sure, were having their phone calls and their strategy discussions. Board members were having it internally, and at least in San Francisco, it's very insular. We're a city and county with one school district, one community college district. Oftentimes, people think that might be easier, and actually now in my 4 years of serving on the Board of Education, and now also being 4 years in the city, I actually at times seems we're actually very insular. And so that's something that, as a reflection around how important it is, and that's how we've continued, I think in my tenure, we'll continue to lead around the collaboration, being connected to our colleagues from Santa Clara County to Alameda County and up to Marin.
I agree with everything that everyone has said here. I think listening and also recognizing that we can't treat communities like a monolith is going to be extremely important on any policy level. There are a lot of people who weren't ready to go back, and there were people who were, and who did trust what they were hearing, right? So recognizing that and creating options instead of creating a divide. And also recognizing that if those options are out there and people can see them with their own eyes, private schools in San Francisco they opened in October 2020. So the inequities of the shift of our public schools at that time for families who had gone back to work was growing daily, not to mention the suffering that the children were going through. I'm sorry, I said I wasn't gonna cry, but I get really emotional and I'm very sad when I think about that time. So just, having those options available, being honest with the community. There was a lot of language, one of the reasons why I got involved, about how COVID was affecting Black and brown families at a higher rate at the time, which is why we didn't want to go back. And I had to remind people, that's not necessarily true. So just being honest and meeting people where they are at a time where there's so much changing. And I agree also that being honest about, hey, this might change tomorrow. That's how you rebuild trust, and that's how you continue to have the conversations openly and honestly.
I think for us, early on, we sort of used a framework where we said, there are things that we're just not going to have control over. We're not going to have control over COVID and how much there is at any given point in time. We're not going to have control over the public health guidance that might be coming out. But what are things that we do have control over? And for us, it was really around roles and responsibilities, relationships, and responsiveness. And so pretty early on, in about April, May of 2020, there was a core leadership structure established for this is how we're going to respond, and here's who's responsible for responding to COVID and communicating to principals and communicating to the community. And there were folks, myself included, who had been in Oakland for a long time. And so new people had some trust established of, I know that this is hard, and I know it feels like it keeps getting harder, but I'm there with you. And so nights, weekends, early mornings, our team was just trying to be as responsive as possible, especially during those periods when things got really hard. During the various phases of reopening, during Delta, during Omicron, everyone was just maxed out. But those were the moments in time when, because principal stress level was high, because parent stress level was high, teacher stress level was high, the responsiveness at those junctures was incredibly critical.
I think that in reflecting on these different communities had different perspectives, and it's one of the really important pieces that I feel like I learned during the pandemic is that there were some people very, very stridently calling for school to reopen completely without actually really any mitigation layers, and then other people who said never, we should not open until my children are in college. Understandably, that there's a lot of anxiety, but the voices we heard were actually much, much, much stronger from people who are saying that we should reopen with limited mitigation, mostly because it tended to be those were people who are less affected. Oftentimes, they were not part of disproportionately affected and generally Black and brown communities. And so it was very important, particularly when I got to more leadership levels, both here in the city as well as at the state, to really be paying attention to voices we were not hearing and reaching out to those communities. That was another really important piece. And the hardest part was that the middle ground was actually the right way to go, which is go reopen those schools. You had to listen to both sides, which is reopen those schools, but reopen them successfully so that people can stay in school. They won't get infected. Teachers won't get the infections, which meant multiple different mitigation strategies. Initially, we talked about the social distancing, 6 feet between kids, masking, testing, all of those mitigation strategies, which for the poor schools were extremely hard to implement. So our learning towards the second part of the pandemic, which was when we were really trying to get schools reopened, mostly in 2021, was to try and understand how can we really give lots of implementation support to the schools and to reassure families who had been in school districts that were historically underfunded that they would get the resource they would need to be able to implement things like masking, like being able to support their kids so that they could go back and do hand hygiene, where schools were like, we didn't have soap in our soap dispensers last year, so we don't trust you to actually be able to do masking and testing and screening for symptoms, right? So that was a lot of the how do we get that middle way through, and how do we create trust so that people feel like that can actually work? And the last piece I'll say is that there's actually the data issues were actually also very important there, and I think a big piece of our future pandemic planning, which is hopefully we will not have another pandemic, but if we do, I do feel like it's very important for the schools conversation to think about kids getting back to school, and another metric, not just infections of COVID, but the metric of how many kids are back in seats as we roll as we would reopen or take away mitigation strategies to really make sure that we're understanding the effects of our policies, not just on infections, but also on those really important other key outcomes, which would be children's education and kids in seats. Thanks.
So those were some really important lessons learned, and I'm reflecting on something I think Dr. K said this morning, which is it's not a lesson learned unless we use it again the next time. So I want you to think then about the future, and God forbid, the next time a similar critical situation falls upon us. What have we learned that you think will be able to move forward? And I guess that's another way of asking, have we made any meaningful and permanent changes in our policies, in our systems, in our communication strategies that will better prepare us?
So you guys basically just heard my answer to those questions, but I will add one other piece that I think was also a really great lesson learned that I think we could probably do a lot more practice of, which is in other countries and sometimes other states, there tended to be a lot of very good, consistent communication from leadership, like executive leadership, like governors, in like standing next to business leadership, standing next to school leadership, everybody saying, sort of economics, everybody saying, we have talked together, we are in communication, and this is what we think is the right way forward based on these sets of values of, supporting people economically, supporting people to get back to school, making sure also public health is really being protected. And I'm sorry, in the leadership lineup, there should have been a public health person also, the one I was just describing. They did that successfully, pretty successfully in Rhode Island, and also I believe it was in Iceland. Those were the sort of the stories that I heard of the most, and I actually feel like that's extremely powerful set of communication, and we could have potentially benefited from it in the past, and also something we should think about in the future.
Yeah, I agree. I think like having the right representatives at the table to just talk about what is this actually like in my context and specifically in schools. I think the other thing that I was reflecting on is, early in the pandemic when the state wholesale went into lockdown, not just individual school systems making that decision, there was a classification for essential workers. And what that meant for us in Oakland is that, we made the decision to close schools on like that Friday. And everyone just kind of dealt with that in their own way. But that Monday, we were able to open some schools for food service. So we were still able to keep access to food for our families. And I remember being at a school that week, serving food and having families come and just being so grateful of like, I couldn't buy milk at the store. Thank God you guys have milk in these bags. Thank goodness that this is available to us. But we were able to do that because food service was still, providing food in the community was still allowed at that time in the lockdown. Schools, teachers, principals, custodians, all of the social workers, all of the people that you need to run a school, we're not in like the initial classification of essential workers. And I think that that's just something to think about as we reflect on how the pandemic closed things down in a wave and then reopened them in various waves. Where, given that our experience of how students were affected by those closures, where do school staff fall in that essential worker classification, and when in that closing and reopening process should schools be prioritized for reopening?
I wanted to also add to Dr. Brooks, around how imperative leadership at its highest level needs to be. And in our context of our discussion here today, I see it as the state of California. I'm born and raised Californian, Bay Area kid, East Bay girl. And I think looking back, how critical that, needs to continue to be. And I'd be remiss if I also didn't name how critical our labor partners need to be at that forefront with leadership. Because some of the things that, even when we did come back, and we're still experiencing to this day, is a workforce crisis shortage. We do not have the of our educators, our teachers, when they were sick themselves or having to care for their loved ones who were also sick, that really provided that not having the adults, the people in the school buildings, so let alone addressing all the things that our students, when they do arrive into our schools, and the supports that are needed. So I just wanted to at least also acknowledge and recognize that is still something that, and we have a workforce that has left the sector. They're not coming back. And what are we doing as a state to address from not only our educators, our paraeducators, our teachers, but the mental health providers, the mental health counselors, the whole community schools approach is going to be really imperative as we look ahead.
Yeah, I think messaging, I keep going back to that because it's really important. I think consistent messaging as much as possible that can happen amongst public health officials and professionals. I think it's important to use plain language. I just learned that upstairs, and recognize that medical jargon might not really be as easily understood, right, by some members of your community. And I think knowing your community, in particular, San Francisco is kind of a special little place, at least we pretend to be, right? And San Francisco had an amazing response. We had a wonderful response in ways that other cities throughout this country didn't. So not letting a national conversation become the conversation for your community, going into community-based organizations, each and every one, and getting that messaging out early and often and plain, I think, is really important in preventing some of the things that we did find where families have now left our city. We've lost, I can't even remember what the number is now, of students in our district, which is putting us in a situation of possible state takeovership. As Jenny mentioned, educators didn't come back. And a lot of that had to do with the length of time that we stayed closed and that we weren't getting consistent information. So messaging.
Thank you. I want to invite the next question to come from an audience member. Does anyone want to jump in? As you think, I'll ask the next one as people think, and then please raise your hand if you have a question you want to ask. So one of the things that we really struggled with as a health community was all of this other information was coming from non-scientific sources at the same time, creating this incredible deluge of misinformation. Can you talk about the impact that had on your work, and whether you've developed any strategies to try to deal with that as we move forward in a world that seems like it's going to have a lot of misinformation for a long time? You can. Who wants to go first?
Sorry. Easy question for our times. I think it comes down to trusted messengers, really. Whenever we did community engagements, we tried as much as possible to have someone from our UCSF team or someone from the Alameda County Public Health Department there with us, so that if a question did come up, which they did during those sessions of, I heard such and such about COVID tests, or I heard such and such about the COVID vaccine, or is it actually safe? And I could answer that, but I was not the medical professional in the room, right? So we tried to make it clear, I will answer the questions about the school's rules and policies and protocols, and I will defer to our medical colleague here and our public health expert here for those kinds of questions.
So let me just ask a procedural question. How did you get that medical person in the room? Who did you reach out to? How did you find them? And how did you know they were to be trusted?
Great question. I do actually feel incredibly lucky that I was here, that I was in the Bay Area, and that UCSF was here, and that these doctors, and they stepped up on their own. They said, we want to help. And it was both because they had an investment in wanting schools to be open, because in many cases they were parents themselves, or worked with students themselves, or were pediatricians, and so there was a personal desire that this was an important thing for society and for children. And then there was the Alameda Public Health Department, which also, I think, as a county, realized sooner rather than later that there needed to be a cohesive approach across the county for public health guidance, because otherwise in Alameda County, I mean, we're a little bit different in that we've got about 20 different districts, and they are wildly different districts, right? Because you've got Oakland, which is the big one, but then you've got littler districts, you've got Berkeley, you've got Alameda, and you've got, further out, like places like Pleasanton. And there was a very different response in each of those communities to COVID. And so having the county public health department say, we are taking a regional approach to this, and we are speaking from a public health perspective that this is what we're advising, not just in Oakland, but across the region, was also important.
So did UCSF researchers who happen to know you just pick up the phone and call and say, hey, Ms. Suresh, I know you're going to be part of the school reopening. How can I help?
I mean, more or less, that there were individuals at UCSF who reached out to members of the senior leadership team. We were in the unique position where we actually have linked learning academies that are career-focused in Oakland, and one of them, it's called Life Academy, is a health sciences high school. And one of the teachers at that school is actually herself a UCSF physician. So she reached out to her principal to be like, I am a physician. I am also an Oakland teacher. I would like to support whatever it is that's going on to help schools reopen. And this was back in the spring of 2020 when no one really had any idea what the next few months were going to hold. And she became part of our core task force in the district. And again, held real credibility because she was speaking from both the lens as I'm a medical professional who's actually studied these things and dealt with them on a daily basis in my professional life, and I'm an Oakland teacher, so I understand the realities of what it will take to reopen and actually implement these things in my classroom.
Yeah, I mean, I wish people had called us. No, it was, obviously we formed the coalition and it became more official. In the beginning, it was just a group of parents on Facebook and a group of, parents kind of talking, and I mentioned the professionals. So luckily for us, there were a lot of parents who were UCSF doctors in the group, and they were able to bring that wealth of knowledge, Dr. Noble, Dr. Bardach. And at the end of the day, what ended up transforming was the idea that we can create a coalition across this city and get the information out in ways that other groups can't, and also stop disinformation faster than other groups can't. So we were able to contact them, put it up on Facebook and say, actually guys, this is what we just heard. We did a lot of phone calls to DPH. We essentially sort of let them know, hey, we're here. We want this information. People are asking about it on all these different platforms. You guys aren't saying anything. We can get it out for you. So please let us know how we can help. And that's, an important part of, I think, the journey is realizing and recognizing who can work together to just try and stop anything before it gets worse.
And it's interesting, both of those examples are UCSF researchers who are already out in the community doing things in other parts of their identities besides as a researcher and scientist. So it's a great take home. Commissioner Lamb.
I didn't speak to earlier of what has changed or what is different. And I think one of where we're heading as a district is absolutely the acknowledgement that as one city and county, as one school district, serving 49,000 children every day, that the district must lead in working with our city partners and with our partners like UCSF. And what does that really truly look like? And that is examples since then, the voters approved Proposition G. Thank you all of you who supported that. That was, again, a moment coming out of the pandemic, as we're evolving from the pandemic, that we have to be at the table to be strategizing together so that the resources are going to be having its greatest impact for our children and our school communities. So that's something I wanted to note, and that was absolutely critical as we went. Dr. Matthews retired, and the board also, just within the last 10 months, underwent a search for a superintendent. And we went out into community receiving over 1,000 evidence of engagement with community around what were the attributes in our next superintendent. And now we have Dr. Matt Wayne from Hayward Unified. Came from Hayward Unified, and that was absolutely, now he's kicked off into his 6 months of the leadership attributes around that partnership. So I think that is a huge learning from the pandemic. Around misinformation is just also the importance of building out the district's communication mechanisms and vehicles so that there is trust building. We have a long way to go, but the superintendent now has also dedicated having a team to really building out what how we get that information out to parents, families, and our educators.
Thank you.
I think the issue around misinformation is actually super hard, and I don't actually think we've really solved it yet. I think that a couple important learnings that I've been thinking a lot about, actually, because I also do climate change work, and this is another major place where there's misinformation and conflicting information. So some of the lessons from that conversation is also, you can cite data till you're blue in the face. Data often doesn't change people's opinions, and so much of what you need to do is start out with the trust and the shared values and articulating those and finding common ground before you can even get to the data part. So for me as a scientist, I'm always like, well, here's the data, and I've thought about the data so carefully, and blah, 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 and this is like the best thing, but you can't just lead with the data. You have to start with those other things first sometimes, and creating that conversation is really an important piece of it. And then the other piece that, in reflecting on the pandemic and actually the voices of the, on Twitter in particular, of different people who are citing expertise, my observation was that sometimes voices who are saying very specific things around school recommendations tended to be blinded by their own personal experience. Their read of the evidence was informed by their own personal experience, particularly in the Bay Area where our rates were lower, and if they were coming from a privileged background, their schools weren't necessarily seeing it, and so they weren't seeing COVID in their communities, and so they didn't really understand all of the perspectives and all of the different things that were happening throughout the state of California, and yet they were making opinions on Twitter and citing data in a way that was, I think, I don't think there was actually malintent. It made me realize how important it is for us, as we're trying to say we're interpreting the information for people and trying to have a voice on social media or somewhere else, to be very thoughtful about our own biases and make sure that we've actually talked to many stakeholders on the ground and people's experiences before we start weighing in too clearly and with too much splash, maybe is the way to say it.
So I'm going to ask one last question. I'm reflecting on my own words that seem to imply that the pandemic is over, and of course it's not over. And a lot of, I think, the way the pandemic has morphed has been into a mental health crisis for adolescents. So I just want to wrap up with getting your feelings about how UCSF can better serve your needs as you think about the social and emotional health of our children as they have re-entered schools.
I think we continue to do research in partnership with schools and families, so both in the clinical setting, working with families, trying to help them get connected to mental health resources. The state has an amazing program that they're working on, lots and lots of resources to actually help support child and adolescent mental health. So as much as we partner with them, I think that's a massive thing. I do think the climate change piece and gun violence are the other things that also are entering into the, that are part of that mental health issue. So thinking about those issues in addition, but yeah, partnering both on the research and then also, but making sure it's stakeholder informed, I think, are the important pieces.
Yeah, I agree about the partnerships. I'm reflecting on one of Commissioner Lamb's comments around how over the last several decades, school systems have had to step up to do so much more than just educate students. And I think that became acutely clear during the pandemic what kinds of supports and services students were missing out on, in addition to just access to academic content. And I think as we recognize the scale and the scope of the mental health needs of our students, that is an area where school districts cannot solve that themselves. And they will need the medical community to step up and figure out how to partner to provide those services as much as possible, even on school campuses where we know students are there, we know how to get in touch with them to provide those services. And when there are more acute events like a gun incident or something like that, how to mobilize rapid response support for mental health needs in those cases as well.
I really appreciate this question, and this is something that we're, as a district, tackling. We are so fortunate to have a Mayor Breed, who is absolutely supportive, investing funding from the city for adolescent mental health and behavioral health. And that is not only investments at the city side, but also directly to the school district. So, and for example, SFUSD is a benefactor of working with philanthropy and the city to now grow our wellness centers and middle schools, in every middle school. It's going to take time. And our community partners are also critical to realizing that vision. I think what's going to be absolutely critical in engagement with public health and researchers, including here at UCSF, goes back to the workforce. The thresholds and the barriers to, around the clinicians or, what is that, and I don't use this term lightly, I also come from a background of workforce development, the pipeline development. I think that's where we also have to get real practical around from crisis, right? How we're supporting our children and our students in crisis to what we would call tier 1. How do we support the child and the family to understand, well, what are some of the kind of emerging even symptoms, feelings, and how do we support and from both community and parents and families to supporting their children. And I think that's one thing that I have not seen quite yet around those practicalities. We have waiting lists, long waiting lists from elementary, middle, and high, and our providers, our community providers are saying, we don't have people. They don't have the people. And so again, are there innovative approaches? Is telehealth something that we could be, and I'm not sitting at these tables, I know some of my colleagues like Maria Sue and many other folks at the city are tackling this and thinking about this, but I'm similarly, how do we then build this system together between public systems and our local municipalities?
I mean, in a dream world, there would be a position here at UCSF where there is one person sort of leading this charge, connecting with the district, connecting with the educators that they could go to and say, hey, we need some help here, we need some support. That person could go into those wellness centers and really shore up the counselors there. But again, it's resources and people. And I agree, there were so many friends of mine who were looking for therapists for their children, and the waiting lists were outrageous. So whether or not it's finding a way to meet people where they are by going into the schools and offering up any sort of way for a child to actually come speak to a professional, or just figuring out a way, whether it's telehealth, to really be more, present or more there, I think that would be something in a dream world that would really make a difference, because there are still going to be a lot of children for many, many years after this, and it's not over, as you said.
So let me wrap it up just with a reflection. This is the second time we've brought this panel together, and if I may paint in broad brushstrokes, we have a representative from a community of parents, from policymaking, from implementation, and from science and research. And in now 2 times publicly, but many, many, many times behind closed doors, in real dialogue with each other. And I think when we think about the challenges that we have before us in health and healthcare, in equity and value, in quality, I think these are the kinds of groups that we need to stop just doing science that doesn't make any difference and start doing science that starts to make things better in the world. So thank you to all 4 of you for all the work that you do, and of course for showing up today and sharing your thoughts.